we're starting now to talk more about psychological wellness rather than illness. I'm not saying we shouldn't talk about illness, and that certainly exists and needs to be dealt with well. But this is a much healthier approach to say, let's look at wellness, let's look at thriving, let's look at how we start to shift our emphasis. And it is happening in workplaces. There's obviously been a broadening of the safety remit to include psychologically safe and healthy workplaces. It is more challenging for those of you in the safety space. I appreciate having to get your head around the psychosocial risk factors and hazards, and also about control measures. It's not as straightforward as control measures, for lifting weights or, providing ramps for wheelchair access and so on. But it's doable. But we just need to be a little bit more nuanced in our thinking. Also, there is a welcome shift that's occurring that's shifting from just a reactive response to crisis to looking at more primary interventions and preventative interventions. Just to extrapolate on that last one from primary to tertiary, we need all three of these. We need to respond to serious illness. But an EAP provision is a minimum. It's not going to stop problems. So what you're going to need are also the mechanisms in place so that everyone in the workplace can be part of the solution. They can spot issues early and intervene appropriately to control and minimise harm. But the big game, of course, is prevention. What are the actual causes? How can we create win-win situations where we're creating the environment where people are well, but that's also very good for the bottom line. Historically, people really just focus on the tertiary end and they think they've got it covered. Increasingly, when you look at litigation around psychological safety, that defence no longer stands up. We've kind of covered this, but there's been a shift clearly from just focusing on pathology and prevention to this idea of flourishing. This will be a little segue now. I want to introduce you to our model of psychologically safe and healthy workplaces, but envisaged as a continuum. And this is where I want you to think about your organisations and where you think you might sit on this continuum. Before we look at that though, we need perhaps a definition of what is a psychologically safe and healthy workplace. And these definitions are fairly pragmatic. A work environment that promotes employees' psychological well-being and allows no harm to employees' mental health in negligent, reckless or harmful ways. So all the definitions here are around reasonableness. Simply, it is one in which every practical effort is made to avoid reasonably foreseeable injury to the mental health of employees. So it's a useful definition. Perhaps one thing that's missing in this definition is it's a little negative in that it's just the stick component. But as we'll see, and as we've already touched upon, there's also the carrot. There are a lot of incentives for doing this from a business and ethical perspective. So let's have a look at that continuum that I mentioned. And I know this is complex, and don't worry. I'm going to break it up into three parts over the next slides. But I want you to look at it as a whole first, just to have this sense that we can understand workplaces as being unhealthy, safe, or flourishing. And there are particular indicators of each of those that are fairly obvious when you're looking. And there are particular processes and capabilities that sit behind why they're located at that point on the continuum. A few general points about this somewhat complex slide. First off, when you're thinking about psychologically safe and healthy workplaces, you're thinking about the whole organisation, and including thinking very seriously about culture. So one of the differences for psych safety versus physical safety, I know it's not completely different, is you have to think much more about the interpersonal space. You have to think much more about the social environment. You know, you need to be thinking about things like, do people trust the leadership? do they feel respected? Do they feel safe in raising concerns, either about mental health or anything else for that matter? So this is the kind of space that you need to be thinking about when you're thinking about psychological safety. Secondly, there are many factors to be addressed. You cannot address them all. So the issue is going to be, how do I prioritise amongst these factors? How do I decide where's the biggest bang for my buck? Where do I start? Where do I get some runs on the board? And that's why you need a strategic approach, obviously. Thirdly, that centre there of psychologically safe workplaces, in my view, is the minimum. And I'll make an argument too, you don't want to be trying to get flourishing before you get safe. Do you know what I mean? I see a lot of organisations running transformational leadership programs and their line managers are rude and uncivil and are hopeless at performance management, and the job descriptions are out of date, and there's been no assessment of psychological job demand. So we don't want to be running before we've learned to crawl, let alone walk. Do you know what I mean? It's really important that we don't just jump to the flourishing end. Anyway, what does promote a psychologically safe and healthy workplace? Well, things like good recruitment practices, good induction processes, performance management, good cultural norms, leadership and managerial capabilities, as well as best practice policies and procedures and training around mental health. People in any organisation will give of their discretional effort, and they will give of their best thinking if they feel safe and well in a workplace. In short, if they look forward to going to work. So what happens in these places, you get higher rates of absenteeism. We all know what presenteeism is, don't we? You know, the lights are on but no one's home. It costs twice as much as absenteeism in Australia in terms of workplace productivity. So people are unwell at work or unhappy and at work. And it has a cost that is much higher than the cost of those in the severe end of psychological illness. Do you get this? And the risk is they will drift down to psychological illness the longer that goes on. We know there are more psych injury claims, conflicts, incivility and performance and engagement drops. And, you know, there's lots of processes and capabilities that are sitting behind those kinds of more toxic workplaces. A safe workplace is one... Now this is... I'm going to go through this model, this funny little diagram thing, but really it's common sense that you need executive commitment in this space. You need to then have appropriate policies and procedures in place that are followable, that you have, the people in the workplace have the skills to actually implement. You then need to decide what to do and what not to do. So you're going to need to plan and prioritise. The indicators are obvious: respect, robust communication. Again, it's not nice communication. We need real communication. Almost universally, a problem in workplaces is the ability to give and receive feedback. And there's no such thing as zero harm in this space. We're a fragile being. Being human at times is difficult. Have you noticed that? Yeah. And we can't cure that, but we just do our best. The indicators, though, of flourishing, when you do see it, is very high values alignment, a high innovation and creativity, high discretionary effort, rigorous skilled feedback, and that's both in the giving and the receiving. There's a whole lot of micro skills that sit underneath flourishing. So as I said, don't try to start there. Get the basics right first. If there's incivility in your place and it's being tolerated, start there. If people aren't doing performance appraisals well and people aren't emerging from it with the capacity to grow and develop, start there. Do you know what I'm saying? It's not simply a matter of running mental health awareness programs to lift morale and engagement. I think we have to look at basic managerial and basic communication duties as well. To paraphrase again Peter Drucker, my favourite, he says there's too much talk about leadership when there should be talk about management. And that is that most people aren't down the severe end. Obviously we need to know how to deal with them, and that's part of the training that people need. How do I get them to the professional help? But most people are in that middle. About 60% of the costs for mental health are in the mild to moderate range. It may not even be diagnosable. So we need to shift our thinking a little bit there. I just want to cover quickly, well, what do you do if someone does have a mental health condition in the workplace? First off, what do they look like? Stress itself is not a diagnosis, but you'll begin to see people in distress. About 26% of the population will have a diagnosable anxiety issue somewhere in their lifespan. About 15% will have depression. 1% worldwide will have schizophrenia. 2% bipolar. Substance use, about 5%. And personality disorders, my favourite, about 6.5% of the population. That's a lot of Australians, isn't it? What do you do? What do your staff do? What do your managers do? What you do is going to depend on what your role is in the organisation. We don't need the same skill sets for people at different levels in the organisation, because that's where the rubber hits the road with respect to mental health in the workplace. They've got to manage these people, and they're feeling out of their depth. Talk to the person. The biggest problem is silence around mental health. There are thousands of cases where we've seen good people like yourselves, empathic people, who you kind of know something's wrong, but you don't initiate the conversation. There are reasons you don't. You're worried about privacy, you're worried about stuffing it up. But the evidence is very, very conclusive that having this helping conversation and referring people to help is by far the most strategic and helpful thing to do. Mostly it's about listening, which is actually the hardest of all communication skills. So I mentioned the necessary and sufficient knowledge and capabilities. So we've broken them down here to say that executive staff need to understand the business case, they need to understand compliance, engagement, performance, legal obligations, etc. They need to drive and identify preventative psych health and safety initiatives. And like everyone else in the workplace, they need to be able to identify, intervene and refer. So across all these levels, there needs to be a capacity to identify, intervene and refer. People leaders, so managers, need all that, but they also need to understand psychosocial risk, performance management in the workplace mental health context, and they need to understand the legislation. They also need to understand, are you familiar with the term reasonable adjustments? This is part of the workplace health and safety. If someone has a mental health concern, you are obligated to make adjustments that are reasonable to help them do their job, which may mean changing the nature of the job, duration of the job and so on, or even the location. Just so you know, if you're an officer of an organisation, you can be liable up to $600,000 for breaches of workplace health and safety. The corporation is liable up to $3 million, but an individual can be liable, any worker can be liable up to $300,000 or 5 years in jail. So it's significant. It's not trivial. You really, we're consulting in a very large organisation at present, and they're sincerely trying to do things, but the feeling on the ground is they don't walk the talk. So before we even start, we're going to have to address this. I don't know whether that perception's accurate, but it's dangerous to be rolling out programs until we get more alignment. There needs to be budget, obviously, and I think they need to be modelling and being involved. The only places I've seen it work is where you get the senior executives mixing with people involved in these activities. Internal review, return to work, mental health, grievance, psychological health and safety skills training, recruitment induction. I probably should have added bullying and harassment there. Are they up to date? Do people know how to access them? Can they implement them? That's the big one. That's the kicker. You might have policies, but can people implement them? Now, this is to the question, what are the main psychosocial factors? I think the first one is good leadership practices, right? The second is workplace culture and relationships. You know, is it a happy place, basically? Org change is a risk factor. Workflow and systems. If they're poor, people's stress levels and their mental health indicators will go up. You then you implement stuff at the primary level, at the secondary level, and the tertiary level. I've spoken about that earlier. If you can't measure it, you can't manage it. You know that. How do you measure? What are some of the metrics? HR stuff's really good. Absenteeism, presenteeism, grievances, work cover claims, anything you can. But also, I would do a follow-up focus group and get the qualitative stuff as well. But you must measure it, and that builds the business case for continuing. What are your key challenges? I think there's a few. Balancing psychological health and safety compliance with psychological healthy workplace benefits. It's not one or the other. You need to do the compliance, but don't only do compliance. Workplace mental health is very, very different to community-based mental health. I think one of the things that we feel strongly is you need a psychological approach that understands organisations. You know, in the community, you don't have to worry, if someone's got a mental health concern, you don't have to worry about their performance management or confidentiality or team dynamics or workers' comp. It's very different. That's why one of the reasons the outcomes are so much poorer for workplace-related psychological injury. What you need to do is somehow, and maybe you need assistance with this, is to bridge the gap in understanding between mental health professionals on one side and the workplace on the other. They're two different worlds. Have you noticed that? This is not just an individual issue about individuals and mental health. It's a systemic issue, and you need to be thinking about it as such and pulling these psychosocial levers. There's both the carrot and the stick involved. You must do it. There are compliance reasons, but you should do it because it's good for business. You should take an integrated approach. Start with the basics. Make sure your job fits right and the psychological job demand stuff. Have zero tolerance for incivility. That leads to problems. It almost always predicts bullying and harassment. Have skills around conflict in the workplace. Address the management of performance. I'm not just talking about performance management, I'm talking about appraisals and the ongoing management of performance. Reduce workplace stress. It's hard, isn't it? But it's a key issue. That's that negative stress. Make sure your policies and procedures are in place. Assess psychosocial risk. And then prioritise. Don't try to do everything. Decide where you're going to focus and do that properly.